If cholesterol is not the full story, then what really causes heart disease and what can you do to prevent it? Today on WellWave Now, we are cutting through the myths and getting to the heart of real prevention. Welcome to WellWave Now, your portal for actionable wellness insights. We, Breck Rice, Dr. Bob Levine, and myself, Tim Daniels, are your wellness catalysts committed to elevating your health, embracing your functionality, and optimizing your performance at every life stage. WellWave Now, where timeless wisdom lights your wellness path. And we are thrilled to welcome back our favorite nurse, Mary Yuter, founder of Heart to Soul Cardiac Wellness. Mary brings years of experience as a cardiac ICU nurse and has transformed that and now into focusing on helping people reverse or prevent heart disease through lifestyle and personalized wellness. Today's, we are continuing our conversation on heart health, but now we shift from cholesterol and statins to ask a bigger question. What really causes heart disease and what can we actually do to prevent it?
Hey, welcome back, Mary. It's great to have you on.
Thank you so much. It's a pleasure to be back here, guys.
Yeah, it's so fun visiting with you. You're such an easy interview. It just goes really smoothly. So appreciate you coming in back on. Unlike the rough interviews
That's
we have
because she
with
takes
Dr.
it
Bob.
easy. That's because she takes it easy on you, Breck. When I get one-to-one with her, she's beating on me and makes it tough, you know.
Yeah,
She,
well,
she,
she knows she has to bring it down to an elementary level for me, so that's great. So, but yeah, thanks for being here, Mary. And like Tim said, we did talk about cholesterol, and your numbers aren't the whole story, right? So we wanted to jump into what the rest of the story is when you're looking at heart health. So, with that in mind, Mary, tell us more about blood markers that might be something that we would want to look at and identify if we're getting labs back from any of our providers. If we get a blood draw, what are those key markers we should be looking for?
Okay. Well, first, Breck, what I'd like to do is kind of circle back to if cholesterol is not the bad guy, who is, for those who might not have been in the call before. So a bit of a review is the problem really is not cholesterol, it's inflammation. And a lot of the inflammation is caused by sugar turning into the inflammatory process, the oxidative process, and then into the very low density lipoproteins and triglycerides. And so those are the things that lead us into cardiac disease. What labs do we look at? We look at fasting glucose and A1C. We want to look at our sugars in this instance. We want to look at the fasting insulin. And the reason why is fasting glucose and A1C, they show us our glucose now, today, and they show us our glucose the last 30 days. But the fasting insulin says, how hard is your pancreas working to keep those numbers? You might be pre-diabetic, but if your pancreas is redlining, then you're actually in a worse place. And it's only a matter of time before that'll just be let go and you'll just cataclysm over into the diabetes side. So we want to look at that. We want to look at cortisol. Do you have a question, Tim?
Yeah, the fasting insulin, is that come on your standard panels, or do you have to ask for that?
You do, and a lot of times it's not covered because they test to treat. So if your pancreas is hanging around out there and hasn't let go of the slingshot yet, there's nothing to treat. So they typically deny it. So I have a whole list, my composite blood list on my landing page of my website. Anybody can grab that, and it has the rationales for what to say to your doctor to ask for the test. And so everybody's welcome to that, and we'll give the website later. But I finally decided, so many people ask me, it's like, here you go. But these are the important ones to start with, is the fasting glucose, A1C, the fasting insulin. Other inflammatory markers you might not consider being inflammatory, white blood cells, because you can see if there's a trend for either a chronic or an acute infection by your trend. If a certain type of white blood cell is elevated, it could mean that you have a bacterial or viral infection ongoing. And when you have infection, it leads to inflammation, and that leads to the whole problem. You might have gingivitis in your oral cavity, and that can lead to entering into the bloodstream where you get inflammation, and then the cholesterol comes in to patch up the damage from inflammation and gets blamed for everything when really it's a first responder, you know? So we also look at the cortisol in relation to insulin, because cortisol is girlfriend, boyfriend, where one goes, the other goes. They're like that annoying high school couple. So cortisol and insulin travel around together. So in the morning, your cortisol spikes to bring down your melatonin, and your insulin goes up. Okay, at night, what's happening? hopefully your cortisol is going down and melatonin's going up. So your insulin is going to go down. So if you're eating a late meal after dark, is your body going to have the insulin it needs on board really to process food? So this is one of the ways we can start to get insulin resistance. Cortisol being up, insulin goes up, and it's not needed. Stressors, toxic stress to you. Maybe it's emotional, maybe it's physical. The stressors can cause the cortisol to go up too. High sensitivity CRP, C-reactive protein, is another marker, and that looks for inflammation, especially in a cardiac patient. The ESR, which is called the SED rate, that's your red blood cell sedimentation rate. And when you're inflamed, your blood cells become heavy and they clump together and stick together, and you're more prone to clotting. And as a cardiac patient, blood clots are not welcome. They're not welcome in our arteries, because that's what causes a heart attack, is a blockage of oxygen from the blockage of the blood being traveled through the coronary arteries. And then a couple more, and I have them all again on my sheet. Interleukin-6 is a pro-inflammatory cytokine, and that's associated with atherosclerosis and coronary artery disease progression. And elevated levels can be a predictor of cardiovascular outcomes. Predictor, but we can get in the way of that prediction.
Okay. So Mary, a couple things up. So you mentioned you got beyond I got my, Breck always talks about how I went to Stanford, but really what I did is I used to clean out the classrooms in Stanford. I used to get my education in batches. I'd look at what the professor had thrown away and what people had left on best there. So there are some things I missed in what you said there, which is one, the cytokine. So, and that seemed like that very important. So what is a cytokine, and why should people be on the lookout for that?
Well, this is, I'm not really that well versed in it, but it's a marker that comes out to warn your body or tell your body that there's something wrong. Okay, it's like a red flag coming out. And this particular one is associated with atherosclerosis. There's all different kinds of cytokines, but they do become inflammatory. And I think in the recent illness we saw all over the world, we were seeing a lot of these come out based on the damage in the lungs that was happening.
And that arteriosclerosis, that's what old folks like Bob called hardening of the arteries, right?
Yes. Yeah. Sclerosis. Yeah. Yes.
That's the lay terminology, hardening of the arteries.
Yeah, exactly. And then the lipoprotein A is a hereditary marker and could lead to more cardiac disease risk. And the coronary artery calcium score is excellent. And the reason why, it might not be covered, and it costs somewhere between $150 and $200, which is not bad for a test that's radiology and is looked at by a doctor and a report is given. But that's like a peek inside the artery. That's like, wow, this is really what's going on. And so I think that coronary artery calcium CT scan is a really good idea to see exactly where you are if you're worried, especially if you have a high lipoprotein A, which means you're hereditary. That might be a good thing to look at. And then we can look at fibrinogen. That's a clotting factor, and if that's high, that can signal inflammation. Ferritin is an acute phase reaction for inflammation. It's storage for iron to keep it away from pathogens. Pathogens love iron. It's what they feed on. And we're given an overabundance of iron in all our foods. And stay away from all the iron supplement, especially men do not need to supplement because they don't get rid of it. A woman in menses gets rid of iron, but a man does not. And they have to donate blood to get rid of it. So those are the main ones. But again, you can look at my website and grab it and look at the rationale to talk to your doctor about it. Some doctors will say, well, it might not be covered. Some places, they don't even have it as an option to get the test. So they've completely removed the capability. And then these are tests that help you really find out, looking under the table, peeking under rocks about what's going on. So you have to advocate. You really have to advocate for yourself.
And along those lines, if I take a look at it, I'm thinking about, what my doctor did with me. One point when we were looking at cholesterol and something else, he said, well, maybe we could have you go take the CAC. So CAC, she's very good at that. And I actually ended up getting an ultrasound for something else. So that was all beautiful. But, as you're going down your list there, I think, as mentioned, the insulin one was not part of a standard panel. I knew about CRP. And so I asked her for that. And I think our audience should understand there are two types of CRP tests. So make sure you ask for what Mary recommended there, which is there's a CRP that just looks at general inflammation in the body. And then there's it's called the highly sensitive or heart sensitive CRP is often referred to as well. That's one you want specifically. And that's the one, she pulled on that. But where I'm heading with this, and part of this is, how standard do you think most of you touched upon how standard are these tests when people look for them? And two, if they're not standard, which some of them aren't, when do you advocate people look at it? When you want them to check it when they're 35? You want them to check them if they've got a history of heart disease in the family? But you've given them on the site that we'll give them what to ask for, but when should they ask? When should they ask for it?
That's a great question, Tim. And, I was trying to get my daughter to do this because I think getting your initial baseline is so good. And I remember when I was in my 20s and going to happy hour and blah, 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 and I had my blood test done by my doctor, he said, "You're not going to live to be 50 if you keep this lifestyle up." And I'm like, what? And so I think it's a good baseline to have to go further from there. So I don't think that there's any age that you should start, but I think that hearing this and being aware that these options are out there is start now. There's no downside.
So you've given us a really good guideline of what to look for or what the actual markers are, but now interpreting them, the average person isn't going to know how to interpret that. Where can someone like me get that help?
From someone like me. So the thing is that the way that doctors look at blood work is allopathically, and they look at you within the guidelines that they have to follow.
Yeah, and I was going to mention, what does normal range mean from one person to the next? Because Bob may have a much different normal range than me. I have an abnormal range.
Exactly. And so the normal range now is not taken of a healthy specimen. It's the normal for the community. It's not a triathlete. It's not. So the triathlete is going to be off the hook on the bell curve. And then the person who's really sick is going to probably fall in the normal range on the low end of the spectrum based on what's bad and what's good. So it's looked at least the way I look at labs. I know the allopathic means because I was a cardiac nurse, so I know what the medical system is looking at. But then I look at where you fall in that spectrum and what other labs might be associated with it. So I've used this example before of one of my clients who had arrhythmias, and they put him on an antiarrhythmic medication, and it turns out that it was his thyroid that was causing the problem. And that causes erratic heartbeats if you have hyperthyroidism. So this was missed. And when you look at the whole panel, you can find things that you might not even know about or have feelings about yet. You might not even know you have a thyroid problem. And you can nip it in the bud and start working on it holistically so you don't have to end up going on some kind of medication or God forbid, having a surgery.
So along those lines, so you've kind of pointed out now what the markers are, and you talked on one cause of it. So if we really look at that inflammation, that calcification, then you find it, and that's more important than the overall LDL. To start getting more towards what your actions, but not actually going into the actions yet. What's causing these things? What tends to cause the inflammation? What causes the calcification? So that people can look. Then I guess that is going to lead into some of your action. But what are the causes of this?
Well, the way that I tell people is heart disease doesn't start in your heart. Mm-hmm. Liver disease didn't start in your liver. So heart disease is a downstream effect of a full body problem. So you might have had stressors that raise your cortisol, that causes your sugars to go off. The stress of the cortisol causes you to have a gut problem, and now you have leaky gut and you're not absorbing food, and you have more inflammation and infection going into the bloodstream. And then that also trickles down to the ability to take in proper nutrition. And then again, the stressors on your mindset. And are you living in a sympathetic state? Like, are you always on and not able to switch off? Do you know how to manage your vagus nerve? Do you know how to calm your body down? There are tools that you can do to do that. And then what are you eating? What are you taking into your mind? What is your thoughts on a daily basis? Most people have the same thoughts over and over and over again, and they're negative. People don't wake up and say, today's going to be a great day. And then at the end of the day, today was a great day, and this is what I'm grateful for. And that gratitude can go a long way toward paving the way toward future things. And I do believe that there is a quantum theory, and that what you're putting out, you're pulling back into you too. What your mind is thinking about is going to pull things into you. And that's a whole nother shift. But the basic idea is that heart disease didn't start in the heart. It doesn't start in the heart. It's the heart actually is what manifests the end problem. But that's a great question. And people just, they're like, oh, that's right. That's true. And it is. Yeah.
When you're starting to get at the, what could be called the root cause of cardiovascular disease, is there really an answer to that though?
I think it's based on the individual. Like their past traumas could be causing them a lot of continued trauma that affects their whole body. And then they get the gingivitis, so it's really unique to each individual. I call us our individual chemistry sets, because we're all percolating differently. That's why normal is hard to really look at. It's what's your normal? What do you want to be your normal?
Well, I know that we're all weird, like, Breck and Tim and I were weird. So no, I'm just joking. But as I agree with you, by the way, 100%. What I'm wondering is, are we, by the end of this meeting, are we going to get to the answer that there's some kind of minimal series of tests and evaluations that would be applicable to everybody, that everybody should do, without going beyond a certain point where the individual differences start to dictate different directions that we go in? Do you understand my question?
The bloods can kind of tell you where those problems are from the individual perspective. So your lipids can tell you, your hormones can tell you. Some women don't know that they're perimenopausal. Some men don't know that they're suffering from low testosterone. So I think taking that whole panoply of tests and then looking at it, because it's personalized medicine, you're looking at yourself in a personalized way to find out the best plan for you. Those tests, like your blood panels, your lipids, those are all standard, and that's great. But that's not going to give you the whole panoply of information that's really needed to look at everything correctly.
And what do you tell people who don't have really good insurance coverage, or don't have any insurance coverage, and maybe they're not in a position to take a bunch of tests, to get a bunch of tests done?
Well, I would say if you can, and I say this because not everybody does have these fantastic insurance plans designed that way, actually, by design. So I say get what you can. Get what you can.
Is there a priority that you have for those tests?
Whatever is covered. So take my list and then get whatever's covered, and we'll start there. And talk about their symptoms and problems that they're feeling.
I'm sorry, go ahead, Breck.
I was going to say, you talked about the tests, you'll outline that for our listeners on what to ask for, but you also mentioned a lot of things that we can do for heart health beyond getting those labs work back. You talked a lot about, sugar and stress and gut health. And what about the impact of proper sleep? That's going to impact on your heart.
Before you answer, Breck, on that one, I want to insert something in between Bob's comment and Breck's thing that I think leads to that, which is, okay, how do you get to the point where it's sleep? How do you get to the point where you talked about trauma could be causing things? So is there a cortisol test that you think is going to be that throws off the stress? So how do you work to get at that root cause to then personalize things for people to get to Breck's portion? Well,
you talk to them. Like in my intake, I have a question about sleep, about rest, about emotional support, about stressors in your life. So I go over all of these different life avenues, if you will, to kind of keep that in the back of my mind as we go along. Okay, well, he said he has a really stressful job. His marriage isn't great. His wife's going through menopause, which might mean that's why his marriage isn't going great. And the kids have moved out of the house and he really misses them, and he hurt his leg. And so you're kind of getting all this life story in the background, because all these little things matter.
You mentioned inflammation being a real key indicator. Is that always going to show up in blood work, or is it sometimes hidden?
Um, no, that should show up in the blood work, and the thing that is hidden from is you. So the person don't even know. So, for example, a couple weeks ago, I went to a health fair at a yoga center up here, and it was like $10 for thermography of head and neck. And I thought, well, this will be fun. I've never done that. I'd like to try it. Why not? And it turns out I had a lot of inflammation, and I didn't know that, and I'm due for my blood test myself. And I thought, wow, I eat healthy. I am mindful. I'm doing all the right things, yet I'm still having this problem. What I haven't looked at in a while, and what I suspect, is hormones. And women, when they lose their hormones and go through menopause, it's like the rug's been pulled out from under you. And I was put in chemical menopause in 2009 by drugs I had to take, a drug I had to take. And I took myself off it because it started to create another health situation, a cancer, actually. So we might think we're perking along and doing all the right things, and that's where these health checks come in. And thermography is great because it shows you clearly in color, red, what is problematic. And so, yeah, I think testing and routinely testing is great. And just when you go about your day, just think about, oh, how can I nourish my body today? I just don't want to slam food down. What can I walk away from the table with and be happy about, and do that meal after meal, and then sleep. Work on getting to bed earlier. I wake up like 3, 4 in the morning, and sometimes just can't get back to sleep, but at least I go to bed early. So I'm trying to compensate for that, but I'm working on that
You got to
too.
talk to Dr. Bob when you have him smiling, because you're into the happiness part of the world where he likes to be happy. And then two, you got him to sleep, and he's always on how do you get that sleep stuff. So go ahead, Bob. I know you're chomping. As Mary, we're
But
chomping.
Let's go.
Mary said, I know you're
I,
chomping at the bit to go ahead.
I've helped so many people improve sleep. So it's just something that I know how to do. I've worked with a lot of people. I'm being a pilot and used to running checklists all the time, and having worked in the lab for so many years, and it's procedure step by step. So for me, I've just broken sleep. I break everything I do down that way in a sense, but sleep I've broken down. And it's something that's easily resolvable, but people don't know, they haven't been guided how to do that. So I'm working on an online sleep program that'll be really fun for people they'll be able to purchase it very inexpensively, and it's going to help them sleep, and it's going to help their health. So thanks for opening that door, Tim, for a little. I'm not going to go too far
Yeah.
in the room though. But I wanted to ask you, because you mentioned trauma, and man, people are all over trauma these days. It's just people are going crazy over trying to resolve trauma, and it's a big deal actually. The question is, how do you recommend? Trauma is such a massive, broad area that can happen anytime in life. And, how do you advise people to deal with that?
Wow, such a great question. And, I think we all can look inside and feel some kind of trauma. And not only is your own trauma that you've gone through, but it's ancestral. So what has happened in the DNA is coded into the DNA. So you're actually living out some traumas that have been passed down in your genetic coding. Now we know we can change our epigenetics. We can do that. I saw a great interview, and it was with Mel Robbins and Gabor Mate, who's a therapist, and she was saying that yeah.
Before we go down that path, I'm going to,
Yeah.
I like to,
Uh-oh.
they'll play the rational, straight shooting Midwesterner here. And, and for a while when people used to tell me that, so I'm not going to go where Bob thinks I'm going on this one, because I'm actually going to side with him, Mary. But for those like me, I'm going to give the rationale behind it, so that we don't sound like we're out in
Never land.
So, that the part about generational and DNA things, that comes back to, what we're going to have a podcast on here in a couple of weeks, is the epigenetics. And you said, which is what comes out of your environment.
Mm-hmm.
So what's the really tie there where people say you're coming out, you're tied back to some of the trauma your ancestors having? That's because that trauma, as I've come to learn, causes the genes, that what they go through has caused the genes to express themselves differently. Therefore, their genes have changed. Mm-hmm. And when they put those genes, and those genes then can be passed on to the offspring. So therefore, you can get a straight chemical way through that. Now, then you can have also just a family-based thing, that trauma has caused them to act certain ways that cause them to put certain restrictions on you or act in certain ways with you, it has changed the way that you're expressing yourself and you're dealing with some of the things. So I'm supporting you in that one, Mary. So go ahead.
I'm still trying to figure out how that works, how you're supporting her on that. But I think I got it.
No, because Mary said, look, the trauma, to your question, Bob. She said you're not only trauma that you have, but trauma that you have from the past, from past generations, are expressing themselves in you. So I wish some people would look at that. Old Tim, uninformed Tim, would have said, that's a bunch of snake oil, a bunch of hooey. But so that's how what I said, Bob, now supports Mary, because that's how it happens, is what I look for. Okay.
Yeah, very good point. And what you might think is a trauma may not be the trauma. And that's where the story of this fourth grader, Mel Robbins, lying in camp bed, and she wakes up in the middle of the night and there's an older boy that jumped on top of her and started grabbing her, and she was traumatized by it. And the therapist said, who did you tell? What did you do? She said, I didn't tell anyone. He said, did you tell your parents? And she said, no. And he said, that's where your trauma started. You didn't feel safe enough to tell your parents. And he asked her, what would it be if your daughters did not come to you? And she said, I would be so sad. It would mean they didn't trust me. He said, exactly. So the trauma may not be the actual situation. And then what happens is we have these beliefs that are just, it's like, our neural wiring has been wired.
Reinforcement.
Yes.
Yeah.
And that's our way of being, when really we're operating at a deficit that's affecting all our health, including our heart downstream. So I think, the people to have on your team, I had written this down. Let's see, a primary care physician, a cardiologist, a therapist, a holistic educator, facilitator, mentor like myself, a massage therapist, an acupuncturist, a chiropractor, a trainer, and holistic treatments like an apothecary and traditional Chinese medicine. I'm not saying do this all the time, but definitely a good therapist will help you get out of therapy and understand the proper tools. A massage therapist every once in a while, an acupuncturist every once in a while, a chiropractor to find that there could be alignment that is not right, and that's pulling nerves and muscles out, and it could be from something you're thinking. You're stressed, it's pulling your muscles out of alignment, and correcting that imbalance can help to release some of that stress from your mind. So the mind and body work together. And then traditional Chinese medicine, things like yoga teacher, I guess you'd say. But there's so many things, and it's not to say do them every day. We want to keep this simple and enjoyable, right? Simple and enjoyable.
I think your conversation just opened up like a weekend seminar or something.
Absolutely. We're all sitting here biting our tongues wanting to put input in, but you've covered so many great things about, checking. You need to, it's just like any, we're a very sophisticated vehicle, right? And if you just ran your car and didn't ever have any maintenance on it, it's finally going to give out. And that's the same. I've always felt inflammation was kind of that check engine light. What you're saying is it's not okay to just put a piece of tape over the check engine light and just keep driving, right? We actually need to now do something about it.
Exactly. Yeah. Well said. Yeah. And, there was a question about like supplements, and again, keep it simple and enjoyable. So you could supplement till the cows come home, but we should be getting most of our healing from our rest, from our movement. And what is the antidote to cortisol? Movement. It's saying, body, I'm in charge. You're not going to stress me. I'm going to get rid of this cortisol and move. And specifically when your cortisol is up and insulin is up, moving the bigger muscles, getting those worked out like squats or walking, engaging the glutes and the quads is going to help get rid of some of that increased insulin and insulin resistance.
We could go into the mind-body connection so fast here and so deeply because, wow, I mean, some people are with the identical conditions are affected. Some people are not. Why is that?
And why are some people able to smoke every day and drink every day and not have any sunlight, and they are just
living
I used to see them.
Yeah.
I used to see them in the hospital and be like, really? Okay, doing my intake on them. Okay, well, maybe this act as formaldehyde on you. I don't know. You're pickled and you don't even know it. I don't know.
That's why I think the internal, I think if we had an internal stress monitor, like a little dial here that we could look at and say, oh, wow, I have no idea. I had no idea this was going on. My internal stress level on a scale of 0 to 100 is like 95 right now, and I don't even feel it. So there's something I have to do right now. I think that internal generation of stress is and unrealized by a person is really that's one of the ultimate killers. And talk about affecting cardiovascular health, right?
Yeah, what's going on in our mind? Definitely. That's an
Yeah.
excellent point. I don't know if the Aura Ring has like measures the moisture on your hand, like if it can find cortisol, but that would be a really interesting tool to invent.
Some of my wooier friends that are more wooier and wooier than me have told me about things you can wear that sort of describe your personality or your degree of tension and stress. I don't know. I've never tried it, but if anybody's interested, they may want to go out there and investigate that.
Yeah, that sounds interesting.
So in this next segment, we really wanted to look at let's do prevention. How do we prevent now? We know how to identify the problems. We know that we now have all these great markers that we can look at, and we have you to help us interpret what those mean. But now, how do we prevent heart disease? Let's get into some of those tips.
So, well, first of all, we want to watch that sugar like you're doing, and things that cause inflammation, getting regular checkups to get your bloods to see what's going on, if it's chronic or acute, getting those dentist appointments in, getting the right amount of rest, and then your mindset, learning how to calm the nervous system so that you can get into a parasympathetic state by stimulating the vagus nerve, breath work. These are the things I use in my program. So I start with the mindset, breath work, things that can bring us into the parasympathetic state.
So
Then we move.
along those lines right there, Matt, you got right to where I think where I was hoping you would go to is because you also laid out the team. Some of the folks you had on your team I wouldn't have on mine, but that's your team. Like a chiropractor, I wouldn't have a chiropractor.
Oh, come on, Tim.
I knew Tim was going to bring that up.
We have
You
to
know
talk, we have
what?
to talk about that.
It's so important. I never thought, and you just think someone's going to take your neck and crank it, but they can look at your body and your alignment. And when you're out of alignment, what's going to happen if you're like this and you don't even know it? They can assess you.
Yes, but I would go to a kinesiologist. I would go to a physical therapist. This is the side note, but we're gonna throw a side note. I didn't really want to take us down that rabbit hole, but I did. But I have a buddy here who, to your point, he was at a conference, and I have to. It's at a conference, and chiropractor walked up to him and said, "You've got this or that with the back." He said, "Yes, how'd you know?" She said, "I'm a chiropractor. I could tell." Said, come see me afterwards. See me after. This is the guy, two sport athlete, when he's in college, still works out 20, 30 years later, every day. Body, all the markers we talked about, good shape. Body fat percentage is probably 10%, which is beautiful for his age, et cetera, et cetera, et cetera. So he went the last day of the conference, went to see that chiropractor. Chiropractor was adjusting him. Next thing he did, last thing the chiropractor did was do that old head twist. Guy had a stroke. and so when they took him into the hospital, and I said, what happened? Have you had any manipulation recently? He said, yes. He said, we see a lot of people with that. Okay.
Tim.
No, so you can add other stuff, Bob, but they see a lot of stuff with that. And I know a lot of people believe in chiropractors and go to them. I didn't say that. I just said I wouldn't be on my team. And that's one of the reasons they wouldn't be on my team. I don't let anybody twist my neck. Since I was a wrestler, I don't let anybody twist my neck around.
Tim, I was a two sport athlete too. Dating and eating, were my two sports. So.
But I know you want to respond, Bob, but I don't want to, and I'm not going to let you this time, though. I'm going to have
come on. You're trashing chiropractors, and it's inappropriate. I want to say one thing. Chiropractors have one of the lowest health insurance costs, liability insurance costs of any kind of practitioner. Okay. It tells you everything you need to know.
No.
The stories that you hear about are so rare Anyway, that's all I'm saying.
They actually aren't rare. But also, just because they might have, it doesn't tell me the whole story. And I want to get back to Mary. It doesn't tell me the whole story because there's a lot of reasons why they can have a lower thing. They're not treating cancers. They're not treating certain things and working with them. They're not doing ABC. They're not having great some types of surgery. So that's another reason why it's not there. I just wouldn't go to them. I think Mary's allowed to have her team who she wants to have on her team. Bob, you and Breck are allowed to have on your team who you want to have on your team, but so am I. And I just wouldn't have a chiropractor on my team. So, but Mary, the point where I was—
You're going to get the last word. I know that's okay.
The point where I was going to is you've got all these great things, you've got the team, and it's how do you start with people? And so you start now they're ready to make that change. Are they coming to you, or they want to do a little bit on their own? And you started to say one was that, I think it was the mindset. So how do you really start with them? What's the right way to get them ready to take and make these changes?
So you have to start with a patient or a client where they are. And in my program, we start with a mindset to learn about the stress and how it affects the body and what we can do to get ourselves into the parasympathetic nervous system state. What's that going to do? It's going to lower your blood pressure. It's going to lower your heart rate. It's going to decrease the stress on the gut. It's going to help to get rid of the problem of not absorbing the right nutrients. It's going to literally help you and as the best baseline. And it's a week by week, step by step, slow approach where those other ancillary providers aren't involved. Those can be something I recommend to go outside but it's basically the tenets of working with stress, mindfulness, rest, and then the gut health, improving immunity, improving absorption, detoxification, then adequate tactical strategy for nutrition. So every meal is nutritious. Then a circulation protocol. What can I do to improve my circulation? What can I use as active blood thinners? Why would I need a blood thinner when I have this? How can I get off the blood thinner? I'm flying, Mary. What do I do? For the plane flight. I'm going to high altitude, Mary. What do I do? And then moving on to a sprinkle of Eastern philosophy and Eastern technologies, let's say. And then incorporating things like PEMF, class 2 medical device PEMF therapy, and red light therapy. So that whole component.
So why the red light and why the PEMF?
PEMF because the certain class 2 medical device that I have on my website, I cannot say the name, but it is a class 2 medical device. It is the only PEMF mat that continues the benefits for 12 to 18 hours after you've had a session on it.
And what is your website? Oh,
it's HEARTTOSOULCW.com, heart2soulcw.com. And it increases circulation to the microvascular level. And the Navy SEALs use this brand in particular. And there's even an equine model. And I now live in horse country. And a lot of the horses that are competing in events like jumping, the trainers use this on their horses for recovery and also for relaxation. When you're going to travel a horse in a trailer, or some of these horses are flown, they use this technology on the horse. And you think EMF, that's bad, but oxygen is bad at toxic levels. This is a low therapeutic level of EMF that keeps stimulating the vasculature for 12 to 18 hours. And that's why it's so good. Other mats you get on, you get off, and the treatment's done and it doesn't last. And the best time to do your treatment, if you can only do it once a day, is at night, because at night we're sleeping, we're not moving, our blood has a propensity to gather together. So this is going to keep that circulation going. And if you're getting on a plane flight, having a treatment at home before you hop on your plane flight would be excellent for you. Yeah. So that's great. And then the red light therapy is really great for helping the mitochondria in the cells. We're light beings. We're infrared at night. You can put on infrared goggles and see us at night because we are infrared. We give off light. And light therapy is a new thing moving to the forefront, as is frequency medicine and the healing power of frequencies. For example, when an opera singer is singing a high note and a crystal shatters, the crystal is vibrating at the same level as that singer. And when that note is struck on the glass, it breaks it. So what happens when you do that to a cancer tumor? What happens when you do that to calcification in an artery? What happens when you can use that kind of technology for healing? So red light therapy is one avenue like that, as well as these other things that I'm learning about myself that fascinate.
And the PEMF will help that as well. You know, I won't claim this one, but I'm starting to adopt it just the path you were on, which is that you know, medication is used and cells respond to medication. They're starting to find that cells respond better to energy than they do to medication to stimulate things, to break things up. And that's what the PEMF is about. And it's also about, it also gets down into, in that energy, it'll get down for a number of reasons into that mitochondrial level, and it'll improve oxygenation at that level and create ATP, adenosine triphosphate, which is the basic unit of energy that all the cells get their work done. So they replicate better, they take things in better, they disperse things better, they clean the waste out better. There's just so much that PMF does in the entire body as you root in your work. In and of itself, it'll work on the whole inflammation system on the body, kicking up good inflammation and modulating it, helping to get rid of bad inflammation in there, and it will affect the whole blood flow chemistry.
Yeah, and I have 3 clients that use it. One is a retired rocket scientist, one is an orthodontist, and one is retired. And they've all tested their blood pressure before a treatment, after treatment, and 6 to 8 hours after, and their blood pressure stayed down. I'm not telling you this is a cure-all for blood pressure, but this is when you're opening the microvasculature, you're letting more blood flow.
It's predictable that would work.
Yeah.
Because,
yeah. I'm a big fan of the Class 2 medical device that you're both speaking of, and I know Dr. Bob is very familiar with it as well. And I'm glad that you talked about those successes. But let's talk about in general patients that you have worked with or consulted, because we'd like to hear some success stories. So give us some success stories where people have committed to a lifestyle first approach.
Well, one of my clients didn't want to do the meditation, wanted to skip over the mindfulness, and his wife said, "Why did we spend this money if you're not doing it?" So he went back, started from ground zero, and he said he cannot not meditate. It sets the tone for his day. He has a high pressure job. He'll go out and take his walk, do meditation, start with meditation in the morning. It was a game changer for him. He ended up reversing his diabetes, canceling open heart surgery because his heart disease had been reversed, and went from 16 pills a day to none. He's like the guy who made the most progress. Other clients have gotten off all their medications, and I continue the program where people can come twice a month for the group coaching calls, and they continue to come. I don't charge for it, and they all stick around, and that's a good sign too, is they are into it, they're into learning and supporting each other, and that's the best you can ask for.
That's really fantastic. And getting people off medications, in my view, is one of the, and even though my PhD is in pharmacology and I studied drug mechanisms for decades, that's one of the most important things to do, is help people get off the meds, because they're all band-aids to a certain degree. Some are better than others. Some are really not very good at all. So the more we can get people off the band-aids and address the source of these, whatever condition it is. And I just want to acknowledge you, because your program is actually bringing in let's say a traditional Chinese medicine or an Ayurvedic medicine approach, where it's almost like in traditional Chinese medicine, they talk about if you have a pain point surrounding the dragon, you don't go right at the thing, you go at it from all these different avenues. And so if you look at cardiovascular disease as the point, you'd be going after with all these different avenues and approaches, and that's what you're doing. And I just acknowledge you for that, because I think it's one of the most, it is the most important way, in my opinion, to address ill health conditions. So thank you for doing it the way you do it.
Wow, thanks for saying that and for putting it so succinctly. I love that.
Thanks. Yeah, you're welcome.
So,
you deserve it. You deserve it. It's great.
Along those lines, and another one. Also, I'll support you on the meditation too. I'll give you a little way back, long. See, it's just the chiropractors, Bob.
Tim, first of all, I want to acknowledge you, because since I've known you in the last 1 year plus, you have really made some wonderful, amazing modifications to your thinking, which you have chosen to do. So I just want to acknowledge you for that.
I appreciate that. But this I appreciate that, Bob. Thank you. And I try to remain open. But the meditation that one actually goes way back. I actually got laughed about it myself in college a long time, which was almost as long as when Dr. Bob went to college, but not quite. And that between my junior and senior year, I was a 50-50 wrestler. Senior year, I went up and all of a sudden it was 10-1. They said, what made the difference? To me, I said, meditation. They laughed at me, but I guess back to Bob's future visioning. I looked at what was wrong and corrected. And then later on, so that started me on that path. And I worked with some very, very good martial artists from mainland China who were in the different types of meditation, and got in, and I could really see that will change the way it will change things, change mentally me. I saw in college and how it impacted that way it was manifested. But I also got to understand the physical changes, how it would drive energy, how it can drive the control of hormones. And so it's a beautiful thing. The only other one I can, and Breck's been saying to himself, why did Tim let this one go too? And I can't. The other person I wouldn't have on my team is a yoga person. I would have a Tai Chi or Qigong person in there.
I knew
fair enough.
But that was going to come up.
They're all great disciplines, though.
Yeah.
I don't have that exposure. So had I had that exposure, I definitely would. I've just gotten into a little Qigong. I've seen a couple of things and I really like what I've seen. So I will bless that. But you got to stop throwing the twigs in my bike tires I'm riding by. I'm like,
well, look, but you talked about movement and Tai Chi, Qigong, yoga, Pilates. Those are all movement-based approaches. And so the trick is have one of them, have something, right?
Yeah.
There's a lot of ways to get the job done, really.
Yeah, even after our blood sugar conversation last time with you, Mary, about just do some deep squats because the sugar accumulates right there in your thighs. Man, I've been having later dinners because my work schedule, man, after dinner, I got to do some of those deep squats, get that blood sugar out of there. So
good job.
That's good.
Yeah, it all matters. It all adds up.
Yeah, we got a thing that Bob used to like. And my wife has come to like this one. One of the few things of our podcast, mainly because I take part in it, that she doesn't listen to it. But see, I got to listen to a couple. And the one that she did like was the movement snacking, Bob, that you like. So she takes movement snacks now that goes into these different types of things.
That's a great thing. Movement snacks. I had just never heard of it before, but it was great.
Right. But I do, and we won't dive into it here, but I have one, it is a little bit of jealousy on the fact that yoga has swept the nation and Tai Chi and Qigong haven't. But there are all reasons also, which we won't dive into, why I don't like yoga for certain segments of the population to start with them, where I think Tai Chi and Qigong is much more universal and much more for almost everybody in some form.
Yeah.
But that said, so, and I guess it's been my day to take us off on these rabbit holes, so I apologize. But so let's get back on track here. One key thing that you went into was helping getting off medication. How do you, and that's a beautiful thing, like Bob said, how do you work with them and how do you work with their conventional providers to make that happen safely for them?
Well, the proof is in the blood work. So you do the work, and then at the beginning of the program, we do a baseline so we can see where you're at and have a consultation about what we need to work on. And then at the end of the program, 9 weeks later, 10 weeks later, we take a look at your bloods, what's going on. At that point, there should be changes if you've done two things. If you've had discipline and consistency in doing things habit stacking week 1 onto week 2 onto week 3. So by the time you reach week 9, you have curated a new way of living. You basically have a new lifestyle. And from that starts to come changes. It's not going to be immediate, not necessarily, you might not move the needle too much. But when you're moving the needle, that is your rationale to say to your doctor, this is working. I want to decrease my medication now. So that's your rationale right there is here's what I'm doing and here's what the results are. And I want to take this down and I want to keep taking it down. And doctors will fight that because they have their standards that they have to go by. And if they're not going by those standards, then they're out of compliance. And they're rated by patients compliant with their medication, not by how many people they've healed and have gotten off medications. So how would it be if doctors were rewarded for truly getting people well?
I say that prayer all the time. That's the big question. And in compliance to who and with what? That's the question too. I just want to make sure I say this. I want to acknowledge you for your 9 to 10 week program, because that's an ideal amount of time. That's the amount of time in my clinical experience with a lot of thousands of patients. That's the amount of time that people not need, but works well with people for making changes in general. If you have the right input, and you obviously are providing the right input because you're getting people making changes that are demonstrable at the 9 and 10 week period. So kudos to you for that and your program.
Thank you.
Yeah.
You're welcome.
Well, we sure appreciate having you on, Mary, again. It's great. And you've taught us so much. Heart disease is not invisible. It's not just a number on a blood test, and it's not, how your, body functions. It's everything combined, right? It's how you live. It's how you manage stress and how you move and make movement snacks a part of your life. And speaking of snacks, proper food, proper sleep. I mean, there's so much that goes into this. And so I think the important thing here is that our listeners understand they can take back control, right? They have the tools now. They have the knowledge. They can connect with Heart to Soul CW.com, and they can know that they can ask the questions. What does this mean? Okay, I got this back and says my A1C is this, but what does that actually mean? So now we have some good ideas on the tools and how we can support our listeners' wellness journey. So thanks again so much for being here, Mary. It's always a pleasure.
Oh, so my pleasure. I enjoy talking to you guys. It's fun.
And then I'll add one thing in here. So this Mary.
There we go.
Yeah, I told you Mary gets tough.
Here we go.
How can you tweak my program? So despite the fact that I tweaked Mary's program, and I would, I can't help but being a tinkerer. The proof is in the pudding. And I think the actual full phrase is that the proof of the pudding is in the eating. So people have been eating Mary's program and they've been getting results and they've been getting healthy. And so who cares what tweaks Tim Daniels would make to Mary's program, because it worked.
Yeah,
It just goes to show you, because you're healthy, Tim. There's a lot of ways to get healthy and be healthy.
We also want to invite all of our listeners to join the WellWave Now Healthcare Disruptors Facebook group. There's great information there for you, insights and resources. Plus, you can connect with great providers like Mary there as well. We look forward to next week, WellWave Now show. And Tim, who's on deck?
We're having Dr. Frida Wiley with us, who is a researcher, a pharmacist, many other things that she's brought to bear.
Ghostwriter.
And as part of that, though, she comes from, we talk about generational genes and impacting things. Her great grandmother, I think, was a herbalist. And so she's taken that into work and combines it with the pharmacies. And very much one of her focuses is food as medicine, and how do you use that to heal and for performance and for longevity. And so she's going to give us some foundation in that next week.
Yeah, looking forward to it. Well, thanks again, Mary. It's great to have you on. And thank you for everybody listening. Always remember, wellness, it's in you.